Ask Dr. Wilson to come up, talk about Obamacare as he sees it as a physician, and keep what I said in the back of your mind along with what Reed's going to say, and then I'd like for us to look into the future and see what exactly might we be able to do to make a change.
Well, they're shifting to my slides. I just wanted to mention that today's December 7th, and it's a big day today. My father, who passed away this year, was a vet. He had wings from the Army, Air Force, and the Navy. And so December 7th is something that we still should remember.
Yes.
My name is Reed Wilson, and I am president of Private Practice Doctors. I tend to wander around as I talk, so if I'm wandering too much, just let me know. The first portion of this talk that I'm going to give is a talk that I give to doctors. So you probably have not heard this. I just gave it last November 1st in Dallas to several hundred doctors, and the reason I'm not giving the second portion of the talk is because I updated everything, because everything's changed in the last week. You will notice on the quotes that I'm going to give you on these articles that they come from MSNBC, CNBC, ABC, CBS, and other more left-wing news, because I don't want us to live in an echo chamber. We know what we believe, and we know what we feel. And I want you to hear and see what is actually being said. And the truth is out there if you just look for it. I think all of you believe that you know about Obamacare and what's going on. I'm going to say right now, and you can tell me later, I don't think you know 10% of what's going on. I don't think you know 5% of what's going on. And initially I was told these people know everything what's going on with Obamacare, so just go to the alternatives. And I will do that, I will get to the alternatives, but I want you to be totally educated, because you don't know. You know 10 times as much as physicians know. So what does that tell you about your physician? You are going to have to educate him, her, to know what's going on. This is going to affect your life. This is your health care. This is how you get medicines. This is how you get your care. This is how your children get their care. This is critical. Can I have the next slide? Remember, these first few slides are what physicians are seeing. This is what I gave to physicians. Physicians know that they're getting hit hard in money. They have to keep their practice open. They have to pay their employees. If you take a look, this is up to 2007, the amount of cuts that your physician has undergone. I doubt you've seen this slide before. This is 2007. We're up to 2013. Just double all that. It is almost impossible to keep a private practice open. Now, they've done a survey, next slide. They've done a survey of what you, as patients, perceive your doctor did. And this is from a journal you probably don't get. And it's from the American Academy of Orthopedic Surgeons. If you take a look, this is total hip replacements and total knee replacements. The black represents what you think your doctor should earn, on average, if he does that procedure. $15,000. If you look at the gray, you, in general, were asked to estimate how much you thought Medicare paid the doctor. You thought he got about $8,000 evidently. Basically, he gets $1,000. Your estimates of what your doctor, that rich bastard, is getting is wrong. And doctors are being driven out of business. Next slide. What are we doing to try to react to this? We were doing what everybody else is doing. One of the first things we do is we cinch our belt. I type up all my reports. I don't have anyone doing it for me. I do my own billing. I have staff doing my billing, but I'm the one who takes the checks in and enters them in and keeps my QuickBook account. Next. So thumbs up doctors, we have one in the audience who said, I can't do this anymore. I'm out of here. Bye-bye. Next slide. We have other doctors who said, I'm going to sell my practice. And I'm going to make a load of money because I'm selling it out to the hospital. This has happened in Santa Monica. The chief of your breast surgery program just sold out to Cedars Hospital, Julian. I don't know if I say names or not, but a lot of doctors have sold out. And what they're doing is they're playing an arbitrage game. What they're doing is, right now, if you come to my office and get an echocardiogram, I'm a cardiologist, I get from Medicare about $300. If you get, using the same machine, because I asked this hospital what machine they used before I bought mine, if you go to Cedars and get that same echocardiogram read by an equally trained physician as me, the hospital bills $1,500. So that what is happening is you're changing the billing over, and the hospitals are billing vastly much more money for the same exact procedure. They can therefore pay the doctors make money, but this arbitrage will not last. The government knows about this, and pretty soon they're going to go to the $300 for the echocardiogram, and what's going to happen to all those physicians who are employees? There's also something else which you don't know about. It's called the Crimson Score. The score basically goes and they go to each of the hospitals and they say, what's your average hospital admission? They go to the doctors and then they get called into the principal's office. And they say, your average hospital length of stay is, I'll make up a number, 2.5 days. If you're a private physician, you go, I'm doing the best I can to take care of my patients. My number one concern is my patients. But if you're an employee of the hospital, you are subject to that hospital. And if you're an outlier, never be an outlier. If you're an outlier at 3 days, your job is on the line. The first thing you're going to do is come back and you're going to start discharging patients, whether they need it or not. I told you I'm going to tell you things no one's going to tell you today. Next slide. Doctors are going broke. Doctor oncologist just here in Santa Monica broke. Great doctor, I happen to have trained with him. This article mentioned him. Next slide. As I mentioned to you, more and more doctors are being bought out by hospitals. They're no longer interested in you because you have the relationship with them. They're beholden to the hospital. They have to make the hospital happy in order to survive and to get paid, otherwise they get fired. Just a few years ago, 2002, well, it was about 10 years ago, 70% of all practices were owned by the doctors. 30% were owned by hospitals. This crossover point happened roughly in 2007. In 2013, 30% of doctors own their own practices. 70% of doctors are employees. A medical student coming out today wants to know one thing. Who is going to hire me? The average medical student comes out with $175,000 of debt. You live in Los Angeles, you want to buy a home. Remember, you've had delayed gratification. I started practice when I was 32 years old. I was in training up until that point. You know, I wanted to start a family. I was married. And now you're going to give me an average of $175,000 net average. That means half the people have more. And you just saw the reimbursement rates. How is this going to work? Next slide. So they've told me, now, you know, I've got my reimbursement, so what have I done? I've cut all my excess costs. I work harder. I'm almost 60. I know I only look 25, but it's true. I work harder today than I did at 40. I've assumed almost every administrative task in my office, so I don't have to pay an administrator. I've gone and investigated other sources for income, like the millions of dollars I'm being paid today. Finally, I'm being told by all the experts that I need to work smarter. What in the world does that mean? I don't know. You know, there's a result of all this. Next slide. I'm hitting a wall, as is all my other physician friends. Next slide. So we have a path now. We can sit here and just take it, and this is what I'm telling my physicians, because this is what you're hearing now. You're hearing what I'm talking to physicians about. You can break down, or you can make a breakthrough. Next slide. You can stand up, or you can sit down. And this is where it switches over from physician to you. You can either sit down, or you can either stand up. Because ultimately the choice is yours, because all doctors are also patients. We all go to the doctor. Next slide. You have to say, count me in. What, are you going to do anything about it? Are you just going to sit there? Or are you going to make a difference? Next slide. Or are you going to say, I'm mad as hell, and I'm not going to take it anymore? I take it most people in this audience remember this movie. Next slide. I'm going to give a few more instances of the stupidity of the system and where we're going. In the old days, today, we have what's called ICD-9. This is a code which we make for every diagnosis that when you come into my office, if you have an upper respiratory tract infection, I give you a code, and that gets submitted to the insurance company for billing. There's a code for appendicitis, there's a code for pneumonia, there's a code for all the diseases, but that's not good enough for the government. The government now is coming up with ICD-10, and they want me to report you for every little thing that you have wrong. There's a code for walking into a lamppost now. Next slide. There's a special code if you burn yourself while water skiing. I have to go code these things in order to get paid. Do you think I have time to go look up the code to see if you burned yourself water skiing or not? Next slide. There's 72 codes related to birds. I'm telling you things that you thought you knew all about Obamacare. I'm giving you the physician perspective. Your physician does not know this. They don't want to. They're ostriches. Doctors don't want to know. Next slide. So now I want to get to all the part of the plan that I've changed because when I initially did this talk in November, all we knew was that the website was screwy. It had a glitch. Now, there are several things, I'm just going to talk about the website. I have to talk about the website because you don't know how bad it is. And realize the website is just a website. We still have to take care of people in the end. The ultimate goal of Obamacare or any healthcare system is taking care of you. But to take care of you, we have to get into the system. So first thing, we have to get onto the website. Next slide. Remember, I told you I was going to quote only liberal sources. CNN. And I'm only going to quote you things that happened this week. I've changed all the slides. December 1st, CNN tried to go live on the air onto the Obamacare website. Remember, December 1st was a key date. They were going to have it fixed. It's going to be a wonderful experience. They were able to get into the state of their choice. But you know what? After that happened, they hit an error message. And they couldn't go any farther. December 2nd, CNN reports there's a new feature to the website. You can get put in line now. This is marvelous. So we have a very fast website because now when we try to get onto the website, we can get our error message quicker and we can get in the lines quicker. This is the easy part. Remember, I'm going to assume as we go in each step that the step above it that we've just talked about is working perfectly. Next slide. The New York Times says, with coverage for many people scheduled to begin in just 30 days, the insurers are worried if it'll be fixed on time. It's December 7th today. It was, if you didn't sign up by December 15th, you didn't have health care January 1st. They changed it to December 23rd. But it's not just signed up. You have to have your check in their hands on December 23rd. Next slide. So in order to do this, you have to choose a plan. Okay, so I choose a plan. There's one. Next slide. Most of the top hospitals, if you go to now, You, with all of your insurance, can go to just about any hospital in the country. If you sign up through Obamacare, almost every top hospital only allows you to choose 1 or 2 plans to be a part of it. Some people are shaking their head, and they already know this. For example, if you go to Cleveland Clinic now with your insurance, they'll take dozens. You must have Medical Mutual of Ohio from the Obamacare plan to be seen. They won't see you with any other, or you can pay cash. Next slide. So I looked at the top 15 hospitals, and I looked up the LA hospitals because that's where we are. UCLA. If you do not select Blue Cross or Health Net, if you select Cigna, Blue Shield, United Health, you're out of luck.
Health Net's only the bronze plan.
Bronze plan is Medicaid.
No, bronze isn't, but I'm saying Health Net doesn't
Right.
do it at all.
This is what was listed on from their site.
Yes.
Next slide. What about Cedars? You have a choice of 1. You don't go to Cedars if you don't have the right plan. It's not just in Los Angeles. Look at Barnes. You must have Coventry Health. I don't even know what Coventry Health is. Look at Indiana. What if you live in it? What if your kid is going to the University of Indiana? I know a lot of my friends have their kids in college, and they're going to Indiana. What if you have their insurance for them? I doubt you have that plan. You have your kid's plan under you. What are you going to do if your kid goes back east? What if your kid goes to Penn or to Drexel in Philadelphia? Next slide. Okay, so let's assume the website is working perfectly. No problem. You've got the perfect plan. The people in this audience probably don't have to worry about a subsidy. Next slide. But the insurance companies have not been told how much the premium the government is going to pay. How are they supposed to bill a patient if they don't know what the subsidy is? You know what the answer is? The Obama administration has told them, estimate it. How do you estimate something like this? Next slide. This is, mind you, go back 1 slide if you can. I'm quoting the New York Times, that conservative bastion of news. Next slide. Okay. You got on the website, it's working smoothly, because it is. You've chosen your plan, you've got the one with your hospital. It's working perfectly. You figured out your subsidy, even though no one else has been able to do it. How do you get that information to the insurance company? Next slide. New York Times, bastion of conservative thought. Insurers say they're getting duplicate files. And more worrisome, sometimes they're not receiving the information at all. That's okay in October, when there were only 6,000 total forms coming. The insurers were doing it by hand. They were by hand fixing all the errors. But this is not going to work for millions and millions of people who need to sign up. So just because you sign it doesn't mean anything. I'm going to take a side note just for a second. When you sign up for Obamacare, it has to talk to the VA hospital, the Veterans Administration, because it has to see if you're a vet and you have any special privileges. It has to talk to Social Security. It has to talk to Medicare. It has to talk to the IRS. Some of those systems are written in COBOL. Do you remember COBOL? I don't know, the people in this audience probably do. Remember, those were the ones with the cards, and you used to carry the cards around to figure out. Some of those systems, HTML and COBOL are not like this. Nobody writes in COBOL anymore. If you think they are having problems, you ain't seen nothing yet. Because in order to figure out your subsidies, it has to talk to all these systems to figure out what your benefits should be. New York Times, next slide. Okay, we're back to our checklist again. The website's working great. We've chosen our plan. We've even been able to figure out our COBOL subsidy. We've even successfully, if you ever hear them talking, it's an 834 when they're transmitting it to the insurance company. It's a real tough form. It has your name, your family, your social security number, and the insurance you want to buy. It's tough information to transmit. They can't do it. But now, you've gone, let's say you've gone on Amazon. You found a coat you really want to buy. You put it in your shopping cart, and now you're ready to pay. Next slide. New York Times. The back end hasn't been built. It's not there. You put it in your shopping cart, it's not there. Next slide. Henry Chow spoke before Congress. He says 30-40% of the site's not built. And the 30-40% of the site that he has not built is the payment system. Nothing. Next slide. You know this guy? He's a big, big Republican. He said, and I'm going to read the slide to you, that this is his words. There's no doubt that the back-end systems will continue to be a source of concern. There's payment mechanisms for subsidies that I think the technical guys have said at HHS haven't been built yet. You can't buy squat on this system. Next slide. Okay. The website, we're on it. We've chosen our plan, we got our subsidy. We've even successfully been one of the few to transmit our information. We've even called up the insurance company and we walked over to the Mutual of Omaha and handed them a check, because Mutual of Omaha still exists. Now we have to have verification. Don't you want a card? So when you go to your doctor? Next slide. New York Times again. Insurers are being deluged with people who think they signed up with the program through Obamacare. They don't have any record of it. Next slide. ABC News. The Obama administration has about 126,000 people who have been able to make their way through the system. They've been told they have insurance. But nobody knows if they really do. Next slide. This is my favorite slide. New York Times. Because the New York Times says that if you go to your doctor with your and say, I bought insurance on Obamacare, your doctor might have no record that you ever bought insurance, and he might not see you. And you can find this upsetting. You know, the people were upset a little bit when they saw extra water coming on the Titanic. Speaking of December 7th, I'm sure the U.S. was a little upset when the Japanese bombed the island. You're going to be a little upset. You're screwed. You're not going to have insurance. There's no record of it. This is what you wanted. Oh, Mr. Obama tells us. Next slide. Okay, I'm going to assume that you got your card and everything's fine. But what about security? I just have to stop here and remind you, I haven't even got to healthcare yet, have I? This is just getting the insurance. This is why this will not work. Next slide. We're talking security. If you like my healthcare information, you can steal it. Next slide. Kennedy is a guy who's a computer expert. This is a guy they hire for security. And he says basically your data is a critical risk. So you're putting on your mother, your father, your children's information. Every piece of personal information is on that site. And welcome to it. Next slide. Online security expert. He spoke to the House of Representatives. He spoke on CNBC, that other bastion of conservative news, and said, you can't do this. You can't just fix the site. You have to scrap it and start from scratch. My very, very favorite thing is just read it 3 times. I'm just going to stop here and then I'll read it. Because it's a federal site, if you are hacked or if there's a vulnerability, they do not have to tell you, and they are not liable. It's your problem. This is the worst thing of all. They set you up for failure, and it's your fault. I don't know, did anybody know this?
Yes.
Okay. This is on CNBC. This is on 11/25. That was a little over a week ago. Next slide. So where are we now? We have 5.5 million people who have lost their insurance. In 16 days, today's the 7th, 23rd, so in 16 days, if I did the math right, they must be signed up with a check-in to keep their insurance. Next year, this time, 50 million people are going to be in the same spot. Next slide. And now I'm going to go and present to you the rest of the problem. Because up to now, we've dealt with trivia. The website is trivia. Your security is trivia compared to what's going to happen. There is supposed to be a projected shortage of physicians in 1 year. 2015 really is 1 year away, not 2. Of 62,900 physicians. 10 years after that, 100,000 physicians. Roughly there's 100,000 physicians in the state of California. That'd be a state like the size of California not having a doctor. It's spread out around the United States. And Time magazine, not a conservative publication at all, has talked about this. The doctor is out. Next slide. The people who take care of Medicaid patients, remember all these people are being thrown into Medicaid, the extra 32 million people says, if you do the math, it doesn't work. That's the director of the National Association. Your favorite news source, Chris Matthews and Schultz et al., says there is no way we can meet the demand with the existing workforce we have. We are going to, keyword, radically change. We're going to have to radically change the way we deliver health. Next slide. Yep, this is an uplifting conversation so far. Okay. We are in big problems. We're going to have people showing up at doctors' doors and there's no one to take care of them. So we have this great system. The website's working great. People have their cards. No one is there to take care of them. Next slide. If you like your doctor's pay cut, you can keep your doctor because your doctor is going to take a lot less money. If he accepts a bronze plan, remember the cuts that I showed you in the second slide? He gets 70% of that. No one can afford to keep that office open unless you're having a mill. Just churn them through. Next slide. This is what, now we talked about the doctor shortage, so we have less doctors. Now we're going to talk about influx of demand. Remember, we work on the supply and demand. This is Medicare over the next few years. Here's where we are now, roughly, with how many people are in Medicare. Now, baby boomers are all getting older. It's going to double. Next slide. The Affordable Care Act is going to bring in an influx just this year of 32 million people. Remember, we have less doctors taking care of more patients. And it's really important for most people in this audience because Medicare, how much money have they taken out of Medicare over the next 10 years? 500 billion. 500 billion. You can come up with different numbers. But remember, as the baby boomers increase, the number of dollars is decreasing. Why do you think they're coming up with all these new rules in the news? It does make sense. I'm going to go back to medicine for a second. Women are told they no longer need mammograms when they're under 50. I'm going to give you a hard fact here. Before we did mammograms, we used to find lesions at 3 centimeters, roughly average. After we started doing mammograms, we found them at 2 centimeters. As you know, the earlier we find a lesion, the better you have a chance to live. So let's go back to 3 centimeters. Do you know why they did that? Basically, it was none of this analysis was done by radiologists who read mammograms or oncologists who are cancer doctors. They found roughly that it took, at age 50, I'm making up a number by giving you the relative values, you had to do 1,000 mammograms to have 1 positive. If you're age 50. At 40, it was 1,500. That was not cost effective. They drew a line. I don't know about you, I take care of people in my office. I cannot tell you how many people, women between the age of 40 to 50, that I have found of breast cancer. And we've saved them. I haven't saved them. The mammogram saved them. These are usually women in their reproductive years, have young children. The reason we're doing it, because the bean counters are going to looking at the dollar and saying, we don't have the money for this. Screw the 40-year-old women. And the 50-year-old women just get it every other year. They came out with a new recommendation that men, it's not just sexist. Remember, it's a war on women. The men should not get PSAs anymore. PSAs are prostate-specific antigen. They don't want to pay for it, and they don't want to pay for a biopsy to see if you have it. If you have an aggressive prostate cancer, hasta la vista, baby. Just 2 weeks ago, they came out with new recommendations for cholesterol guidelines. I don't know how many of you know them. I was interviewed about it, and I'm going to tell you they're awful. Basically, what they want me to do is put you in a little calculator based on the Framingham data, which is 20 to 30 years old. Do you smoke? What's your age? What's your race? And what's your sex? And do you have high blood pressure? I answer those questions, and I put it in a little Excel spreadsheet. If your 10-year risk is 7.5% or greater, you go on maximum dosage of statins, cholesterol medication. Period. You're done. You're out of my office. Go away. There's no individualized care. None. They want to not pay for anything. So if you come to me and I say, gee, let's look at your family history, let's take a look at your coronary arteries, maybe you want to do a 64-slice CT, and individually tailor your care to you, the government is telling me drop dead. That is not the way I am supposed to practice medicine, because it's great if you're just churning people through. You plug them into the equation, and bingo, you have an answer. Next slide. So, are doctors happy? 60% of doctors say this is going to negatively impact their practice and their level of care. 51% said, I'm not going to be able to maintain my doctor-patient relationship. 90%, this is a good one, 90% are so disillusioned they're telling their family and friends not to go into medicine. Just happened to me. My nephew wanted to be a doctor. I told him, get out of here. Find something else. You're not going to do it. This is my nephew. I gave a talk to 100 people just like similar to this. And I asked the people in the audience, raise your hand if your son, daughter, father, brother is going into medicine and wants to go into medicine. One person raised their hand. The kid was 8 years old, and instead of a fireman, he wanted to be a doctor. I wanted to be a fireman. Next slide. Who is going to take care of these patients? My name, if you go onto the list, is listed as I'm going to take care of them on the Obamacare website. They have my name listed under Health Net and Blue Cross. I'm not taking care of them. This is me. 44% of doctors are not going in New York, blue of the blue, are not going to participate. 75% of those who are listed as participating only do so because they have a contractual obligation that they have to fulfill. I don't care. I'm still not doing it. 25, this is the key, 25% of those participating volunteered to do it. That means 75% said no. I'm not playing your game. This one, the next slide, just came out yesterday. Next slide. Insurance brokers who know, because they asked all the doctors, 70% of California's 104,000 licensed physicians are boycotting the exchange.
Yay.
You can't tell by looking at the site. Like I said, I'm listed. I have several patients who are insurance brokers. They said, "Reed, your name's there." I said, "You know what? I'm not doing it. I have instructed my secretary." This is an actual case. I've instructed her, when someone calls on January 1st, you ask them where they got their insurance. If they use the word exchange, you say cash only. I will not participate. And obviously, I'm in the vast, for the first time in my life, the vast majority. And this just came out, I had to give Joel collated all our slides together, and I said, Joel, wait, I gotta get this slide in. This was just last night, 12/6. Next slide. So this is one of my favorite quotes. It's like giving everybody an ATM machine with this Obamacare card, and there's an ATM card, but there's no machine. You walk around with your card. In Canada, which everybody likes to quote, I got another anecdote. I love anecdotes, sorry. In some cities in Canada, you cannot get insurance. You need a primary doctor in Canada to do anything. And not everybody can get a primary care doctor. In some cities, they have to have lotteries. And if you don't get into the lottery system, you don't get a card, and you can't get referred to a specialist. I'm going to bring up another thing, and this one is horrifying to me. I gave a talk at Stanford to the doctors and medical students. And the topic was, the lecture was, it was a debate actually. What's more compassionate, private health care or government health care? And you sort of like to know your audience before you give a debate, because you got to sort of gear it to your audience. So we asked them, if you needed surgery, where would you rather have it? Canada or the United States? 2/3 of the audience raised their hand for Canada.
Really?
Yes. This is what the medical students are being trained. Remember, who's training them are university-based, not taking care of patients, physicians. They're the same instructors that exist in our college campuses. Don't be surprised. This is the way it is. I'm going to keep throwing down these little anecdotes because they happen to me and I know they're real. Next slide. We're headed for a perfect storm. Next slide. We have two solutions to what's going to happen. You can either force the doctors to take care of Obamacare patients, or you can make new doctors all of a sudden appear. And nurse practitioners are going to be who are taking care of you. After college, I went to 4 years of medical school. After 4 years of medical school, I did an internship for a year. After I was done with my internship, I did 2 years of residency. After I was done with my residency, I did 3 years more of cardiology. The nurse practitioners don't have any of this. I like nurse practitioners and physicians and assistants when they are under the control and supervision of me, taking care of a cold. 99% of my business is taking care of everything except colds. I am an internist. I take care of colds, flus, and everything like that. But my patients don't just have a cold. They can have heart disease, hypertension, elevated cholesterol, and the medicines they're going to be put on for their cold are going to interact with the medicines that I'm using. Next slide. Kathleen Murphy is running for Virginia House of Delegates. That's like our assembly, I guess. She says they should be forced. Doctors should be forced. Forbes magazine, I'm sorry, that one's not that liberal. If Obamacare is not repealed and too many doctors refuse, we're going to have to find some way to force doctors. So I'm telling you what I'm doing. Either I'm going to sell shoes, because I'm not going to be forced to do anything, or I'm buying a yacht. You say, yacht? Because there's 3 miles off the coast. It's not California.
Amen.
And I'm going to see my patients off the coast of California. Next slide. You don't think this is happening already? It's happening already. Right after the ACA passed, those states wanted to broaden the authorities of physician's assistants. And you notice the one there starting with a C? This is where you are, but it's happening all around the country. There are 300, between 2011 and 2012, there were 349 bills brought up to make it so that physician's assistants can take care of you and your heart attack. As of July this year, which is only halfway, so you can make that double, this year, there were those many measures considering the same. You have to do it. There's no doctors. There's too many patients. We're set up for crappy care, and you're about to get it. Next slide. This is something that Joel talked about, and I want to spend time on alternatives. Sorry, didn't know it was so exciting. You're under some big misconception here that everything was la-la land before this Obamacare passed. You're under the impression, not you, but the vast majority of folk who are in opposition thought we were in nirvana of a free marketplace before Obamacare happened. No. It was a terrible system. It was better than what we got now, what we're about to establish now, but it worked, but it was not a free market system. And I'm into free market systems because I think they work. History has shown they work. Next slide. We had some big, big problems. We have a massive entitlement program. I'm going to say some things that Republicans are going to hate. I'm going to say some things that senior citizens are going to despise. But it's time to talk truth here. We have a massive and inefficient entitlement program. And if you like this alternative, it's in the Wall Street Journal, published in November. So just research it. It's called a conservative alternative. You have Medicaid and Medi-Cal, or Medi-Cal is Medicaid in California, and you have Medicare breaking our country. I work practice in Beverly Hills. Some of those folk who live in the 700 block of Beverly Hills get free medical care on my back. It's ridiculous. It's ridiculous.
They paid into this system.
They never paid in this much. When the Medicare was invented, the average lifespan was 65.
Right.
Because half the people would be dead by the time they ever needed it, and the other half were about to die.
Wow.
So no one's paid into this system.
That's right.
Sorry, I'm just emotional about this stuff, and you're going to have to deal with me.
Good. Good.
We have the most ridiculous, lopsided tax treatment of an employer-based system in the world. The employer-based system happened because of World War II, since we're talking about World War II. We had wage and price controls in our country, and the only way we could get extra workers was to give them benefits. So we started with health care. And here we are, it's not 1944 anymore. We need to change. If you want to keep your employer-based health care, fine. You're going to end up in a single-payer system with Obamacare. You're going to have to come up with an alternative. We also have a bunch of individuals who aren't covered by these two called the individual market, which are getting screwed already. And they're left in the gap. So whatever alternative we calculate and we want to do as free marketeers, we're going to take all that into account. Next slide. The key is to enable all people to become consumers. We are a nation of consumers, and we know what we want, and we know what we consider quality. Next slide. This is something that's going to have to top. This tax exclusion for this is number one. What I'm going to propose is that we have, is in one nutshell, is everybody has catastrophic coverage. And this is how everybody gets catastrophic coverage. If you want to get your employer-based health care, fine. But you only get tax benefits up to a point for that catastrophic coverage. If you want more, you pay for more. You go out in the marketplace and you pay for more. Next slide. For those people who are in the independent market, there is a tax credit so that they get refundable tax if they go buy insurance from an independent market enough to buy catastrophic insurance. Does that make sense? You then pay more if you want anything else. But everybody is stimulated to get health insurance. Everybody, because you get your money back to buy the insurance. There's no sticks. No one's fining you. If you don't want insurance, the government will be glad to keep your money. You get the benefit of buying catastrophic health insurance, and you don't have, you're paying for it. You get your money back to pay for it. Next slide. Medicaid also gets that same tax credit. If you can't afford it, we're willing to help you pay for it to get that catastrophic coverage. It's means tested. Everybody gets catastrophic coverage. If you get it through your employer, great. If you get it and you're an individual and you get it through tax subsidy, not a tax subsidy, a tax credit, you get your money back and you buy catastrophic coverage. If you can't afford it, we help you. Now everybody has the same insurance, catastrophic, the affluent, the non-affluent, and they go out in the marketplace and they buy whatever coverage they want. Next slide. This is a guarantee to provide a strong incentive to buy coverage. There is no coercion. Everybody gets insurance. Next slide. People who have a pre-existing condition, we're going to have a pool. They will be covered in a subsidized risk pool. High risk, you're covered. Medicaid, you're covered. Individual marketplace, you're covered. Employer-based, you're covered. Everybody has catastrophic coverage. If my wife and I don't want more children, we can't physically, but if we could, I don't want to pay for maternity care, so I'm going out in the marketplace not looking for maternity care. I don't need prenatal care. Maybe I want long-term insurance because I'm getting older. Next slide. By making catastrophic coverage available to all, everybody's covered at a significant lower cost because there's competition in the marketplace. I can buy it from Cigna, Blue Shield, everybody. I can buy the one I want. Everybody's happy. Next slide. There are no mandates to this plan. There are no taxes to this plan. There are no regulations to this plan. It's a free market solution. You pay for what you want, what you think is the thing to do. You have freedom of choice. You don't want insurance? Fine. The government keeps that money. You want insurance? You're paid for. That catastrophic care is paid for. Next. You need to turn people into shoppers, and you need to encourage competition. You do not need people to be passive and tell them what they need. The difference between you and them is they think they know what's right for you and are going to tell you what to do. The difference is you know what's best for you and are willing to ride on it. Next slide. And Joel said this, congressional Republicans have not made a reasonable approach in ever, basically. It's our fault. Joel is right.
Say that again?
It's our fault.
No, second part.
Joel was, I just can't do it. I've known Joel since I was a little kid. I can't say those words. They've done nothing to help people, us, have done nothing to help people who need the help. You know, I was very interested when Joel showed his slide on how we lose elections. And I was just saying in the back of my head, 47% of people are receiving money from the government. That's a large lead to overcome, because I'm going to tell you I'm going to give you more money and you're going to vote against me? It's not happening. So we have to educate people how this handing out of our own money is not good. It's an education process. Next. Opponents of Obamacare think that we don't have to do anything but watch it fail. Wrong, 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 wrong. And that's what we're doing right now. Our amazing leadership is doing bupkis. They are terrible. If you do nothing, we will have the Titanic. And if you think this is a Titanic now, you ain't seen nothing till you have single payer. Because that's the only alternative out there. The left is willing to let this fail. They actually succeed if it does. They have a win-win situation. They get Obamacare or it fails. Win! Next slide. The defenders of Obamacare use this absence of a statement from the other side as saying, look, it's the only other alternative out there. We have to remove the trump card. Let you decide. Give everybody, all groups, catastrophic insurance, you buy what you want on top of that, and you have success. And that, next slide. Afterward, I'll be glad to give you any comments or anything like that. The people in the audience have to know, have to get this out. You are just the tip of the iceberg. I've given you information from a doctor point of view, what doctors should know and don't. I've given you the most up-to-date headlines from the left-leaning newspapers. I've given you an alternative on what to do and how to do it. And now it's up to us and our leaders to choose our leaders correctly. And if you don't listen to Joel, Joel will tell you how to take this from this simple concept into actuality. Joel.